Okay,
You can label
so
them in a lot of different ways.
so 3 variables. One is how often you do the test, right, and how good are you at doing it. I think that like I probably said this analogy last time, but it's like starting an IV or drawing blood or whatever. It's the same kind of deal where if you do it once a month or once every 6 months, you just never quite get that comfort zone of knowing exactly your angle and depth and all that stuff. Same kind of goes here in that there's some technique to it. There's some kind of feel to what you're doing and knowing, okay, I did everything I could possibly do and it's still a refer. Okay, then it is, right? So we know that on the order of about 5 to 10% of ears will not pass while they're here. And that's okay. I mean, in the state of Iowa, the United States, everybody accepts this 5 to 10% number. It's when you start climbing above that people are like, okay, something's not right. Like maybe it's your equipment that's not working right, or maybe you need to be retrained, or maybe whatever. Maybe we need to manage the babies better or something like that. So experience doing it, and then also accepting the fact that you're going to have a refer here or there. It's just like it just shouldn't be every baby coming through here that you just refer. So then this is what you were talking about with the there's 2 big factors with doing infant hearing screening, especially an ABR type. So I always feel like I have to draw pictures, but so ABR stands for auditory brainstem response. So what this machine does is it does 2 things. One is it plays the sound to that baby's ear, so it's stimulating their ear, and then 2 is it's testing that baby's EEG response. So it's literally testing the electricity that's coming off that baby's scalp in response to that sound stimulus. And then the computer inside here decides that it's not just random noise, it is a true response to that sound. So then we can presume that the baby heard it, right? So that makes sense? Okay. So, but 2 things have to happen in order for that in order for it to work. One is they have to hear it. Like the sound stimulus has to be coming out of here. This has to be tight on their head so that it's not leaking out sound. So we know it's getting enough sound to their ear. Their ear has to be clear, like vernix can't be in their ear and stuff like that. And they have to have good hearing, right? So all those things have to be true in order for that electricity to start firing in their brain, in their brainstem. And then the other thing is we have to be able to measure it. We have to measure that EEG on their scalp. So now I'm going to introduce 2 more variables. On the EEG side of things, and this is the paramount part, is that electrical connection from here to their scalp has to be clean. In other words, these electrodes that are sitting on their scalp have to be making a connection, have to be on there, right? And there can't be gunk in between, like, skin cells or oil or vernix or whatever it is that's on their scalp. We have to get that off. So what we know is the easy screen will allow you to do a test when the impedance is 50 or lower, 50 kilo ohms. 50 is really high, but it's basically saying, okay, it's good enough that if you can't do any better, let's just do the test. Let's just go and see what we get. I'm going to tell you that I think your goal should be, and there's 3 points, right? There's these 3 points you see on this. Y'all are used to looking at the screen when it initiates and you see that those 3 different dots and what the impedance is there. I'm going to tell you aim for 10s, 10 or lower. Just kind of line it up to where you get an idea of where those electrodes are going to hit. So I'm looking at right behind their ear, as you said, right in front of their ear, and then somewhere up on their forehead, right? So if I'm just laying the Barophone on their head, all 3 are making a connection, and I kind of know where they're at. So now I can scrub. So I'm going to pretend that this end has the goop on it.
Now with this, we do not want it in the hair, correct?
Yeah. So they always say as high in the forehead as you can get without being in the hair, because the hair is just going to introduce a barrier, right, to that more impedance to that electrical signal going through there, whatever you want to say it. So, yeah. It looks like his hair is his, her, I don't know, is right about here. So I'm gonna do this, and I'm just gonna tell you, just as a rule of thumb, do 15. 15.
I was doing 10.
Fine, 10 to 15. I'm happy with 10. It's just those people that go and think they're done, that's where it doesn't work. So if I tell you 15, you'll do 10, and right. So now I've taken all the gunk off of, or loosened up all the gunk on that baby's skin. You don't have to put pressure and dig into it. You just scrub. Now it's up to you. I had gone to using alcohol swabs. What I'm trying to get at is, if you have a bunch of this stuff on their skin already, just take an alcohol swab and kind of do this and just kind of get it cleaned off. Now, what I want to do is use the electrode gel, and still with that in mind, with those points in mind of here, here, and here, I'm going to use my little cotton swab. And now I kind of want to just make stripes of that electrode gel on their skin, on their scalp. One thing you don't want to do is connect them. So you don't want to just like do a whole area of electrode gel. You want to do like a stripe, and a stripe, or a point, whatever. But to where it's going to get under here and be, so if I did that stripe, I could kind of rotate this a little bit and still be in the electrode gel zone, if you will. Now, if you don't have to freak out, because if I didn't do really good with the electrode gel, the other thing I'm going to tell you to do is then just take a little dot and then just put a dot of gel, dot of gel, dot of gel. And now I've covered my bases. I've cleaned all the debris off of their head. I've gotten electrode gel to where it's actually kind of permeating now into their skin a little bit. So now my connection should be golden. Now what I'm going to do is, and this is the easy part, right? You could hit new patient, enter their demographic information, and then hit start. Yeah. So now if I hit check mark, now it's on that test screen. So now I make sure I've got the correct ear chosen. So this is his left ear that's pointed up at me. I'm going to do the ear that's pointing at me first, because then it's less rolling around. So it's their left ear, so I'm just going to hit the little ear icon at the top to change it to left. If you're hard on the orientation of ears, everything in audiology is right red, left blue. So if you can't picture it the same, then right red, left blue. So now this color on the Verifone is also telling you that. So if I change it to right, it's red up here also. So now what I'm going to do is now lay this over their head, make connection with that electrode gel, and I can either initiate it from there or I can initiate it from here. So when I hit go, what it's going to do is, the very first thing it's going to do is check my impedance. This is where I really want to be able to see that screen. This is telling me, these red dots are telling me if it's under 50 or not. Remember, 50 is not my goal. My goal is like 10 to 15 or better. So once they're all green, that's telling you they're all 50s or less, and then it's just going to run into the test. But now it's held up here until you get all greens. So something like that, to where I'm all greens, and now once it hits all greens, it's going to start the test. So for you, if I'm questioning whether the Verifone's working correctly, there's two things that I got to make sure of. One is are the electrodes good? And so once I put it on here, I should get impedances of 1, 1, 1 across the board. So as long as it's making connection here, I should get all ones on impedance. And the other thing is, once you've done that, there's no point in letting this go. You're going to get a refer on the Verifone checker, but then just take it off and listen, and you should hear a little bzzz sound. So that tells me there's stimulus coming out. So those are about the only two things that are going to go wrong with it, is either it's going to lose one of the electrodes or it's going to lose the stimulus, and now you've just verified those two things. So the other thing to do is, once you get into the test, the other thing I'd be quick on is using this button. If the baby, so this gets at what you were talking about with their state, with the baby being active. So remember, we're testing electricity on the baby's scalp. The two things to do that well are, one is I have to have a clean electrical connection to that baby's scalp, not picking up fields from everywhere else in the room. And the other thing is he is creating electricity by muscle movement, by myogenic artifacts. So if he's moving around, if his neck is in tension even, I mean, not so much as adults, but if they're kind of stuck in a weird position, or if they're squirming around, or if they're sucking on a pacifier, all of those things are going to create muscle electricity that's going to look exactly the same as what this is picking up. So it can't see through that, so it thinks it's noise. And that's going to make your test go longer and increase your likelihood of a refer. So impedance, patient state, those are your two big things that you can control to some extent. So if I'm testing him, and he's on his side or whatever, and I hit go, and now he's kind of squirming around, or usually it's that first initial step where they kind of like, okay, this is something different. They'll alert to that difference. They'll move around a little bit, and once they decide it doesn't hurt, because it doesn't, then they'll calm down, and their noise starts, their internal noise starts to go down. So what I would do is start that test, like hit go, and then hit pause. Like if he starts to wake up, or you see the pacifier start working, I would just tap it again. If you tap that button, it pauses it. And now just give him 10 seconds or something just to kind of calm down, and then hit go again. And now it'll start averaging clean stuff. The thing with the pacifier is if he's leaving in an hour, and I got a dozen things I have to do, hearing screening's one of those dozen things, and I got to get it done one or the other. So, and he's either going to be screaming at me or he's going to be sucking on a pacifier, I'll take the pacifier, right? Ideally, I'm not in that situation. Ideally, I shoot for some window of time right after he's been fed and he's nice and sleepy and he's at least 24 hours old. Is that okay too? Like, are they here 48 hours-ish? Okay. So then I've controlled all that other stuff, right? Vernix tends to be not as much of a problem after 24 hours, usually. So if you can wait for the 24 hours plus, the chance of them having an earplug in their ear is less. And then if they're well fed, they're nice and sleepy, you can do that. Hit go. If he orients, or if he starts to wake up, just hit pause. Hold him there for a second. Rub his forehead. Whatever magic stuff you guys do to calm babies down. And then just tap it to hit go again and let it do its thing. So then you'll get an answer, right? Then you'll get a refer or a pass. What you've seen already, I think, is that this will take up to 3 minutes. It doesn't take more than 3 minutes to do an ear. It can't. It won't average any longer than that. Ideally, what I want is more passes than refers, and I want it to go as fast as possible. And again, I know I sound like I'm saying the same thing over and again because I am. But if you get that impedance nice and low, get it down to 10, I'll accept 15s, but as soon as it gets to 20, 30, 40, I can almost guarantee your test is going to go longer and you'll get more refers than you want, right? And back to my example of, when we were doing this with people. So you get that test where you get, 3-minute test, refer, 2-minute 45-second pass. I've waited through that. Take everything off, re-clean them, and then go back to your 15 swipes. Swipe it off with alcohol swab. Use your electrode gel, get a good contact, and then what'll happen is that same baby, that exact same ear again, will be a 10-second pass, a 20-second pass versus a 3-minute refer. So now I've just done hopefully, I've achieved my goal of more passes than not and shorter test times. That would be ideal. So the bottom line is your time, and once it goes out, that's your 3-minute mark. artifact is the line above it. If you see that bumping around a lot in yellow, and I look and the baby is like, he is asleep, he is quiet, he's loose, all that stuff. Now I start looking at the other variables, okay, let's turn off lights, let's move away from the printer, let's, leave my cell phone out here. It's weird things like that will start to do that. But the thing is, the having it plugged in and it plugged into power, that can introduce some line noise into this. Everything else is usually taken care of by that impedance, because I don't know how to say this any differently, but so if I'm kind of on here, right, and if I'm really on here, now my connection is from there to the head, or there to what I'm trying to read. But if I'm just kind of on there, now I've kind of opened it up, and now I'm pulling in, it's essentially an antenna, and now I'm pulling in any electricity from anywhere, and it's trying to see through that. And that's when you start to go into, okay, well, I've done, my impedances are 10s, but I'm still getting a lot of artifact. Okay, make sure it's unplugged. Make sure my lights are off. Make sure I'm away from heavy electrical stuff. I'll be honest, I feel like most places don't have to go to that point. Once you've done the other stuff, it's kind of like, okay, yeah, that was... It's possible, and I've seen it happen, where even on the ends of here, the electrode gel will start to build up on there, and sometimes you just have to clean those off to get the gunk off of there. But also, just over time, stuff is going to get in, in the ends. But even like here versus here could be, making a connection versus not. Yeah. The other thing I didn't mention is babies' heads are different sizes. So I don't know if you knew it or not, but this thing rotates. So that high forehead electrode, so if the baby's head is big, like this guy's pretty good size, I can make connection here. But if they're smaller and I make it, but my top one is kind of hovering up here, I can rotate this back, and now I can make a connection on all three. So just keep that in mind. If you have that little, 6-pound little girl that's just a tiny little peanut head, fine. You can just rotate it in to make connection. The only thing you got to be careful here is, again, now these are starting to get pretty close to each other. So my electrode gel, I want stripe, not blob, right? Usually if they're supported, the blanket or whatever is back here, and they're kind of supported, so they don't have to put a lot of tension on their neck, but you have access to behind their ear. That tends to be the best, just because they're not having to move or hold their head, even though they can't really, but they'll try. So then, yeah, so as relaxed as they can be, then he's causing a lot less electrical artifact. Back to the vernix in the ear canals. If they're on their back, then theoretically both ears are exposed to air and can dry out equally. I don't know if that totally happens. A lot of times what I'll hear from places, and this was a lot of times with the OAEs because it was more affected by the crud in their ears, was the first ear I do always passes, the second ear I do always refers. And first, always is a bit extreme, but I get it. It took me a while, but I figured out that babies were kind of mostly on one side, and so they were kind of laying on that right side. And so naturally, I'm going to do the left ear first because it's pointing at me. And then I roll them over, and this one's been closed off, and then I do it, and this is a refer. And you take that OAE probe out, and it's full of cheese. And so, yeah, same goes here. Remember, the two things that have to happen is they have to hear it, and you have to be able to test the electricity from their response. If he's got an earplug of Vernix, he's not going to hear it, or he won't hear it as loud. And so, again, the longer you can wait after they're born to do the test, to do any infant hearing screening test, the higher your pass rate will be. All the research shows that 9 out of 10 babies that don't pass here will pass 2 weeks from now because all that stuff's dried up, long gone. So I guess what I'm saying for you here is wait as long as you can, that you still leave yourself a good window of time to get the test done, right? But then also, if the first ear passes, See if you can't roll them over a little bit and just have them lay there for, you know, a couple hours or whatever. I don't know, you can just park kids like that, but and then try that other ear, and usually it'll be more successful. I've heard people or places do this kind of Vernix breakup massage where you can kind of just like do this and it will kind of break up that gunk, because you're not putting anything in their ears. Where like the OAE, it was almost one of those things where if you put the probe in and you take it out, sometimes you've essentially just cleaned out their ears, and now you can now after you clean off the probe and put it back in, now you get a pass. You're not doing that here, so you're just staying out here. So then really your only options are wait longer or try to break up that gunk. Here's the thing with the hitting pause, it tends to help with this too, but again, if you think about it, it's averaging. So it's basically sending in a little click and averaging the electricity. Sending in a click, averaging the electricity, and it's doing it like 100 times a second. So that's why it sounds like because it's like clicks really fast, yeah? So the problem is that if they're still alert, if you suck it on the pacifier for the first like 30 seconds of that, those first several hundred sweeps, those averages are garbage. They're artifact. And so now it takes another bunch of sweeps just to average that back out to then get to clean sweeps. So now if I just kept them right there and then just hit go again, odds are now I don't even have to mess with that 30-second of garbage averaging. Now I'm averaging clean stuff, and your odds are that it'll be a lot cleaner and a faster pass. Do a screen. If it's 3 minutes and a refer, now start going through the, okay, did I control all those variables and it's still not okay? Just try it again. My impedance is low, but just try it again. Odds are it might pass, especially if you saw that bar kind of climbing up there, but it didn't quite get there in the 3 minutes, and you're like, if it would just gone for 30 more seconds, probably true. So if you just hit go again to start it again, it probably is 30 seconds away from being a pass. But what you don't want to do is be like, okay, I'm going to go in, I'm going again, I'm going again, I'm going again. Yeah, because there is definitely a point of diminishing return on that. So, okay, so then you've done all of that. You've made sure impedances are great. The kid is super sleepy, all that stuff, and I'm still getting refers, or my impedances are garbage, and I've done everything I can do to make it so that this part has been taken care of. I tried the checker. Maybe my impedances are kind of poopy on here then too. So now the good news is you do have something that you can switch to and still get that screening done. So I unplugged the Barophone from the top, and I'm just going to plug in the electrode lead cable into the top. Those connections, by the way, are keyed, so you can't, there's a flat side to it, so if you can't, I shouldn't say you can't, shouldn't be able to do it wrong. How's that? Okay, so now if my instrument turned off and turns back on with this, it'll recognize that I now don't have a Barophone, but I have a lead cable and headphones. So and by the way, there's nothing special about these. This is why I said you could use EKG ones or EEG electrodes or whatever. I mean, literally these are just ways to get the electricity to come from here to here. So okay, so if I select that same baby, now you'll see on the screen how to connect this stuff, but I'm going to tell you just to excuse me. Now, this is going back to cleaning. So now back to what I was originally telling you is high forehead, cheek, nape of the neck. So basically as high on the back of their head as you can stay out of their hair. And now I'm testing both ears the same. The only one that can be anywhere is this cheek one is just the ground, so it really doesn't matter. It could be anywhere, but the cheek's just kind of easy to get to, so that's why we do that. So what I would do is get all your equipment ready. So these are just taking the place of that. So it's just a headphone, yeah? So you can just shove those in there. The good news about the ear cups is you can test both ears at the same time. So instead of doing one ear and holding it and then going to the other ear and then holding it, this one you can just start it and you don't have to hold it for one, and it will be testing both ears simultaneous. But it's just a lot more stuff, right? It's a lot more things to connect and stuff. So again, right red, left blue. So I'm going to be something like this. The electrodes. So if I have cleaned him already, now I would stick these on here first. The only thing you don't have to do with this is the electrode gel. Because
Okay,
the electrode,
so
yeah, because it's...
the prep and then the alcohol swab and then just
Yep,
stick.
yep, that's right. This is where the alcohol swab is actually good because these don't stick as well if you've got a bunch of new prep left on their scalp. So if you just clean it off so it's nice and dry and clean. Now, you've got 3 electrodes. There should be a little picture on here of where to connect them, but I'll tell you also. If you remember white clouds over black ground, if that helps you. So your white is going to be high up on the forehead. Again, as high as you can get without being in his hair. The black ground, again, just somewhere on the cheek. It doesn't matter where. And then nape. Now, you can kind of massage these in if you want to, just to make sure they're making a good connection. Yeah, sometimes if you wait a little longer, that the gel that's inside the electrode has a chance to kind of permeate the skin a little bit. But once it's here, it's here. There's always been kind of this back and forth between like the ear cups and the electrodes as far as making them so sticky they're hard to get off versus not sticky enough that they just peel off during the middle of the test. So I feel like these are pretty good. But yeah. Okay, so then the headphones.
He told us the wires point towards the
Oh, like these?
Yeah.
Like to put it like that?
Other way. Yes,
Yeah.
like that.
Okay. I
And he
mean,
said the picture is wrong, but they're supposed to be changing the picture on the package.
okay. Probably the biggest variable with this is that, again, you kind of want the ear centered in that little dome. And the other part is like, sometimes, you know, if they're really hairy back here and that little sticky is kind of like this and it's just hovering out, and you can do this experiment on yourself. So if you really dome your ear and cover it, it sounds different. But if you just make a little bit of a crack, it's less domed. It's letting more sound in and out. So what you think is 35 decibels getting into that baby's ear is probably more like 20 because some of that sound is leaking out of that ear headphone. So to me, that's probably a bigger factor, but is making sure this is on there. Yeah. To me, so this is fine. And then once you hit go, now everything's the same except you'll see 2 bars going at the same time, a right and a left going at the same time, and that's it. Oh, this is the reason. One of the reasons that people will gravitate towards the Verifone is it's less stuff, right? It's just less gear on them. It's also less cost. You're not using $12 little packets of headphones and electrodes and all that stuff. From nurses, what I hear most is it's this part. It's the, okay, now we're done, and I gotta like peel these off and pull their hair and all that stuff. So there's yeah.
And less room for error. I mean, if you hook those electrodes up in the wrong, will it pass still?
Really, as long as if you keep a yellow and white or yellow and white, it should still be, I think, at the same. It's the ground that matters. Like that, it's not one of these two, but yeah, no, it should make a lot of difference.
Okay.
Yeah. So then, yeah. So now you're in a position where you got to start peeling them off and. Yeah. And then, if your impedance was garbage, you did all this, you went to do the test, and my impedances were 30s, Now you peel everything off. You could probably usually keep the headphones in place, but you got to peel off the electrodes, re-clean, get a new package of electrodes, and try them in because they won't stick then as well. But yeah, so I think you're on the right track. I mean, the Verifone is great when it works, right? Like yeah. So it's the same test. It's doing the same thing. It's just, this is the headphone. This is this.